Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In the clinical features of the first in the clinical features first we have unilateral hydronephrosis. Okay, in unilateral hydronephrosis, mainly the unilateral hydronephrosis, it is most common cause. First, most common cause of unilateral hydronephrosis among all is idiopathic pelviureteric junction obstruction, or it can be due to calculus. So this unilateral hydronephrosis is most commonly seen in the woman, and it is seen on the right side most commonly. Number one, it is seen most commonly in the woman and most commonly on the right side. The main presenting features of the hydronephrosis is unilateral hydronephrosis is in a patient with unilateral hydronephrosis presents with mild pain or dull aching pain in the loin, that is in the area of the kidney. He feels pain which is mild pain and dull aching pain, which is associated with sensation of dragging of heaviness. Why is there heaviness? Obviously the kidney is filled with fluid which is heavy, so the patient will have dragging of sensation of heaviness is seen, and this dragging of sensation of heaviness is, it becomes worse by excessive fluid intake. It becomes worse by excessive fluid intake, and slowly the kidney might become palpable. If the kidney is large enough, it might even become palpable. Then slowly the patient will, when the when there is fluid in the pelvis, in the renal pelvis, when the renal pelvis is completely filled with fluid, so this will stretch the renal capsule. When it stretches the renal capsule, this renal capsule is responsible for pain, because this renal capsule is innervated by the nerve fibers, so this will result in pain. So the patient will present with acute attacks of renal colic occurs, with or without swelling. There is either renal colic can occur with or without swelling. And here in the patients with hydronephrosis, there is details crisis or intermittent hydronephrosis. See, in the details crisis, first and foremost, the patient will have a swelling in the loin, and this swelling in the loin is present along with acute renal pain. And few hours later, and just in a few hours later, few hours later the patient will pass large amount of urine. When he passes large amount of urine, after passage of large amount of urine, the patient will have relief in the pain, and the swelling also disappears. So this passage of large amount of urine which causes decreased pain and the swelling is called as details crisis. So what is happening here is, if this is the kidney, there is some stone or obstruction in the ureter. Because of this, the patient has developed hydronephrosis. Okay, now because of some reason the stone has been dislodged. So now, because the obstruction has been cleared, so now the urine, few hours later the obstruction is gone, the stone must have fallen down in the bladder, and the whole urine, which is whole fluid which is accumulated in the kidney, goes out, has large volume of urine. And once the patient passes large volume of urine, all the hydronephrosis in the kidney is relieved, so the swelling which is due to the fluid filled in the kidney disappears, and the pain is also relieved. So this is details crisis or intermittent hydronephrosis. Later, after some time, again when one more stone comes and obstructs the kidney ureter, the thing can recur back. So that is the reason why we call it as intermittent hydronephrosis, or it is also called as details crisis. Then, if the patient has bilateral hydronephrosis, in bilateral hydronephrosis, mainly the patient develops lower urinary tract obstruction. Symptoms of bladder are common. Among all those, in the lower urinary tract symptoms are common in the bilateral hydronephrosis. If there is bilateral hydronephrosis, kidney is not palpable mostly. Why? Because renal failure intervenes, because where there is bilateral hydronephrosis, renal failure will occur even before the kidneys become large. Because if it is unilateral hydronephrosis, there is one more kidney is available in order to compensate it. But if there is bilateral hydronephrosis, because the other kidney is also involved, both the kidneys are involved, so there is decreased excretion, or excretion of metabolic wastes is hampered, and as a result the patient develops azotemia, resulting in chronic renal failure, or acute renal failure develops based on the uh, consequence.
Thank you and thank you for watching.